So, good morning, everyone. Thank you for coming today to our lecture about healthcare system around the world. It's simply, I will take you to trip around the world to see their healthcare system, because we are familiar with the Iraqi healthcare system, but we have no idea what's going on in US, Canada, Switzerland, Germany, Taiwan. So we need to go there and explore their healthcare systems. So simply, before we go deep to the healthcare system for all these Western countries, we need to understand some basics. Because in Iraq we don't have health insurance, doesn't mean we don't need it. Health insurance is system implemented by many countries, even our neighbor countries. They implemented health insurance. Have you heard about health insurance? Do you have an idea about it?
Yes.
It's simply, we have third party, which is the insurer company. We have insurance company, we need to pay the money, we call it premium, to the insurance company, and the insurance company will pay to the physician or hospital we visit. So it's not direct way, it's indirect way of payments. We pay to the company, which we call the company insurer. The consumer pay to the insurer, and the insurer, which is the insurance company, will pay to the physician or hospital. But also we need to pay something to the provider. We call it co-payment or co-insurance. For example, if you visit the physician and physician charge you $100, you will not pay the $100, you will pay like 20 or 10, and the remaining will be paid by the insurer. This is the way the insurance company works, and it's the same principle for the car insurance. You pay to the car insurance, and if you have an accident, the car insurance will pay to the mechanic or to the car shop, to the body shop to fix your car. This is the way of you need to adapt about the third-party health insurance. You have any questions about this insurance? I will give you more details about it. Go ahead.
What about the arrow from the provider to the consumer? Is it the service or?
The service, exactly. They provide you with a service. Okay. Let's take some terms, because I know you are not familiar with this program. Try to give some terms. First party, consumer or the patients. We are the first party. Premium is the amount of money we pay monthly to the health insurance company. Okay? Second party, the physician or nurse or the pharmacy, any healthcare providers. Benefit, which is the medical health services or the medications. Third party, the health plan. The third party is the insurer. We call it third party. So we have first party, the physician, second party, the insurer is the third party. Let's start with the US healthcare system. We know the healthcare system in the US has high quality, but we don't know the component of the healthcare system. Because we live here in Iraq, we have governmental, universal healthcare system in Iraq. Everyone, every person, when this person needs the healthcare service, they can go to the hospital, to the public hospital, and they can receive the free medical services. Okay? So we have no idea about the health insurance. We have no idea about what about accessibility, because we have access to the public governmental hospital. We are not experienced what's going on in the US. In the US, they don't have universal healthcare systems. They mostly have private mostly and some governmental health coverage. So I can summarize the US healthcare system by its kind of fragmented. It has multiple components and multiple payer. In Iraq we have one payer, the Iraqi government pay to the employee, to the physician, to the pharmacist. They pay. The Iraqi government pays the salary to those employees, okay? And the US, they don't have the system. So what they have Medicare, Medicaid, they have employer-based insurance, and they have private insurance. I will take about all these components. That means they have different components, different institution control the healthcare system. So it's not only one. In Iraq, we have only the government control the public sector, and we have small private sector at evening. They work after hours, after the day hours, they work in the evening. So we have, in Iraq, simply we have two sectors. Public, which is the governmental, which is free of charge. We have private, but in the private we need to pay out of the pocket directly to the physician. So we don't have the health insurance company here in Iraq. So in the US, it's the healthcare spending contributes 16% of GDP, gross domestic products. That means 16% of the US budget goes to the medical services. It's a huge percentage. 16% of this huge amount of money go to the health services. And simply the US is one of the most expensive or most country spending on the health services. You will ask me why. There are some reasons, but they are not 100%. They say they pay high to the physician and to the dentist, healthcare providers. And also they have processing or administration fees. Can you see this guy inside the ambulance? This is the processing administrations. Because if you visit the hospital or the clinic, you will not go directly. There is a person working behind the computer. This person will take your names, information, and they try to process. They try to take the information and send it to the insurance company. So there is work behind the scene, processing the claim. What do you mean by the claim? The claim means if you go to the physician needs to write down, Ali visited my clinic on June 12, and he was diagnosed with blah 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 disease, and I prescribed this medication for him, and I need $100 as a fees from the insurance company. So the physician or the provider need to send the letter to the insurance company so they can get the money back. This is the processing. This process take time, take efforts, and need someone to do it. So this is the processing or administration fees, because you need someone to write this report down, send it to the insurance company, and the insurance company, within the insurance company, they have people working to read this report, to try to process the payment. You can imagine how many people we need to work to sort those claims and eventually pay the money back. So this is the administration fees. So simply, it's one of the most expensive healthcare system in the world, the US healthcare systems. The average family premium is more than 1,000. What do you mean by premium? The premium is amount of the money paid by the patient or the consumer to the health insurance company. Monthly, the family of 3 people needs to pay more than $1,000 just for health insurance. Imagine, it's expensive. So there is something called employer-based insurance. What do you mean by employer? For example, I'm working for the University of Baghdad. University of Baghdad is my employer. I'm the employee. The University of Baghdad is the employer. Okay? The employer usually when they offer the job, they say, we will provide you with health insurance benefit. What do you mean by health insurance benefit? Means the employer will pay most of my premium. We were family of 4 members at University of Iowa. My wife was employee at the university at that time. We get subsidized health insurance. So the insurance company will pay mostly 3/4 of the premium, and we pay the remaining. For example, we were paying around $400 per month, while for non-employee you need to pay $1,200. So we paid almost the 1/3 of the charge. This is the benefit for the employees. So you work for the university or for the employer, for the Minister of Health. Minister of Health need to pay most of your health insurance charge, and you pay the premium. The premium is only 1/4 or 25%. It's not whole charge, which is good. That's why the employer give you incentive to work for this institution. Some small institution, like maybe Walmart, if you work part-time at Walmart or McDonald's, they may not give you the health insurance benefit. So you need to pay out of your pocket more than $1,000 per month. Imagine, there's something behind the scene. We don't feel it here in Iraq because we don't have this healthcare system or health insurance. Because we have the free health insurance here, free health services here, we don't know what's going on in other countries. Something called co-payment. Co-payment means each visit to the physician or hospital, you need to pay something. Why do you think I need to pay something as a patient? Why it's not like totally free? There's country it's totally free, like Canada and UK. They pay nothing. But in US, you need to pay something.
I need to reduce frequency?
Exactly. We call this, we reduce moral hazard. This information may be not available on your slides, so sometimes you need to write down some notes, because not all the information, the recording may help you to remember something, but not all the information I'm saying now available on the slides. Keep in mind, if you give the patients free of charge services, like here in Iraq, the people will go frequently to the hospital. If they are sick, if they are not sick, if they don't feel well, they say, oh, it's free of charge, I will just go to the hospital. If they go to the hospital, they will take time from the nurse time, physician time, pharmacist time. So they will cost the healthcare system much, they will cost them like resources and time. So we need to reduce the amount of visit to the necessary ones. How can we reduce to the necessary? The insurance companies say you need to pay some co-payment or co-insurance. The difference between co-payment and co-insurance. Co-payment is like $10 every visit. That's it. Co-insurance is 20%, for example, of your visit. If your visit cost 1,000, you need to pay 200 because 20%. But co-payment is just fixed amount. It's $10 or 15 or whatever. Okay? Co-payment, single, fixed. Co-insurance is percent out, which is maybe more. To reduce the moral hazard, because if you give them full insurance without co-payment, the waiting list will be long. People will go to the hospital. As in Iraq emergency, some people, they go there, oh, I don't feel well, please take my ECG or whatever, because they don't feel well, and they are like fake, or they claim something not real, because they pay nothing. So in the US, because it's private company, the good thing is private companies such as employer-based insurance cover 50% of Americans. Imagine 50% of Americans had the health insurance from their employers. What about the other 50? The other 50, if you are elderly, above 65, you are covered by the government plan, which is called Medicare. Medicare is a governmental plan if you are elderly. And you need to pay some subsidized premium or co-insurance. If you are low-income person, like you have large family, you don't have salary more than 25,000, for example, or 30,000 per year. You have 2 kids. You are a family of 5 members. There's called poverty level. If you are below the poverty level, you will get the free health insurance or coverage. We call it Medicaid. With 8 Medicaid. For low-income people, and they pay almost nothing. So Medicaid customers, they may have long waiting list for something because the Medicaid, it's governmental, it's mostly run by states, while Medicare, it's run by the federal government. So most people or most Americans sponsored by employer, some people sponsored by Medicaid, other people. In the US, they have Medicaid, Medicare, employer, they have 20% of residents, they don't have health insurance. Imagine. Those people, if they go to the hospital may deny their service, or because you say, you don't have health insurance. Sorry, we cannot accept you here. Why they don't have health insurance? Because they don't have enough income to buy the health insurance. And their income higher than the poverty level, a little bit. Like they got like 35,000 per year. While the poverty level, for example, 25,000. So you are higher than the poverty level, but you still cannot afford and mostly the young people, they don't buy health insurance because they say, I'm healthy, I don't need the health insurance, while most elderly people, or they have health insurance because they have the Medicare simply. A lot of questions about, they say, the US healthcare system, it's fragmented, as you can see this old ambulance car, while the European healthcare system, they are organized or more neat in this case. So the difference between Medicaid and Medicare, we say the Medicare for elderly, while Medicaid for low-income people. We have some details here, you can read it by yourself, but simply this is for the elderly, this is for the low-income people. Behind the scene, what's going on? What about the processing of health insurance? I know you will say, okay, we don't have health insurance in Iraq, and you are teaching us principle of health insurance. Because you are the leaders of this field, I expect Iraq may adopt health insurance in the next couple of years. So if we adopt this health insurance plan, we are prepared. We know about it. We are aware. We can deal with it, because each one of you will be the leader in her or his institution and province. So we'll take the idea. You will increase the awareness about the insurance among the young pharmacists, because everyone around us using the health insurance. I heard some neighbor countries, Turkey or even Saudi Arabia, they have the system. Lebanon as well. So it's coming. It's coming. We need to be aware about it. So it's not too early to learn about it. It's not too early because it's coming. We need to know the principles. Okay. Behind the scene, the provider, after the physician, you visit the physician will send the claim to the third party, to the insurance company. They say, this is the information, I checked this physician, this patient, and here is the diagnosis, whatever, please reimburse me $200, for example. The third party will process. If it's employer-based, I'm talking about employer-based, like when I was employee at the University of Iowa, my insurer was, the real insurer was the university. But the university was the sponsor. The university paid the money to the Walmart, for example, the health insurance, Blue Cross Blue Shield or Walmart at Iowa State. The University of Iowa paid Walmart company, which is one of the biggest insurance company in the Midwest or Iowa specifically. The third party, which is the Walmart or Blue Cross Blue Shield, it's an insurance company. They are third party. The university, the insurance company will process the claim. What do you mean by process? Try to say to the provider, give me your bill, I will process it, I will check the price, we'll check the price, this will cost you $200, okay? They send the bill to the employer, and the University of Iowa will pay the money to the insurance company. insurance company will pay back the money to the provider, as you can see here. So the real sponsor is the employer, but the insurance, they need the insurance company to process the claim. Can you imagine the behind the scene? It's complicated process, it's not easy. Sometimes the process get denied. They send the bill to the patient. I got some good bills, like you need to pay all the money because I didn't have, for example, eye exam in my insurance plan. So when I visited to check my annual eye exams, they say, sorry, we don't cover this, you need to pay $300 for this visit. Check. So you need to know your benefit before you go to any of those providers. You have a question? Yes, ma'am.
You say the processing.
Yep.
This is happening right away, or it's?
It takes time. It really takes time. It takes up to
goes?
1 month or 2 months. Yep.
The patient goes
Yeah.
to
Yes. The patient gone home, and I got some of those after I left the Iowa. In couple months, I received some of those bills by mail because
So you don't know.
I don't know, but my friends say you received some bills. Because I'm an honest guy, I went online and paid those bills. I don't want somebody to owe somebody money, so I paid those bills online. So they will come after you, like they will come couple months maybe. They will keep sending you these bills. They will send you to your address. Some people, I know some friends, they left.
And leave you behind.
Yeah, it depends on the honesty or that. Sometimes, good question, will bring me to something. If you visit hospital and you, for example, emergency room, and they charge you $2,000 or whatever, and you don't have enough money, and you didn't pay back the reimbursement, they say, please pay these bills by August 12th, and you didn't pay this. They will keep sending you reminders, please pay this amount of money by next month. You didn't do it. So what they are going to do? They are going to send it to collective agency. Collective agency, there's company, they try to track you down. They say, Ali, you owe the hospital $2,000, you need to pay them now, please, they keep calling you, they keep sending you messages or even try to visit you, so they have collective agency try to collect the money. Most of the hospital providers, they send the money, they send the claims and collecting claim to collecting agency. They try to bother you so you will pay eventually. It depends. Some people, they try to change their phone number, their address, but they still, you owe money to the hospital. As you can see in the US, press again?
No.
Okay.
Still
So, as you can see, they have 30 million Americans and they are without health insurance. And I saw those people, they visit the university hospital, some state hospitals, they don't accept them. So it's not abnormal for hospital to say, sorry, we don't accept you because you don't have health insurance. So this is the big problem, because if you don't have health insurance, you cannot visit the physician. If you visit this physician, you need to pay out of your pocket, and it will be sometimes even higher, because if you have insurance, for example, if you have insurance, the insurance company will bargain with the provider. They try to reduce the cost. But if you are paying out of your pocket cash, you cannot bargain. You don't have bargaining power because you are a single person. While the insurance company, they bargain with the provider. They say, well, we'll not pay more than $200 for the eye exam. But if you need to pay the eye exam out of pocket, you need to pay $300 because they will charge you higher something. So those people are uninsured people. They are really in difficult situation. Mostly uninsured people in Alaska, in Texas, Florida, those suffering states. What do you think, who are the most uninsured people? The elderly or young people? Hmm? Why? Exactly. The young folks, they say, I'm healthy, I don't need health insurance, I will not buy it. But Obamacare, have you heard about Obamacare? It's Accountable Care Act. It's passed 2010, it started to be implemented in 2014. ممكن بسمر it started to be implemented every single month. They say health insurance is required by law. Before Obamacare, you have the option to don't have health insurance. But after Obamacare, say, if you are uninsured, you pay penalty to the government. You will pay tax to the government at the end of the tax year. So why they do that? Why do you think they force people to buy health insurance? Why do you think Obamacare want to force people to buy health insurance? Why? Something behind the scene. Look to this one. Imagine you are the insurance company and you don't have, as Ban said, who are the most uninsured people? The young people. Imagine if I have the insurance company, okay? And my insurance company, I have only elderly people in the insurance company.
You are paying more.
I will lose my business. I will be out of business in a couple of years because those elderly people, they need so much resources, so much money because they visit the physician frequently. They have 10, as Ban said in the presentation, 10 diseases, 10 scheduled medications. They need so many visits to it. If I only have those sick elderly people as insurance company, I will be out of the business in a couple of years. This is simple questions. If I need to be in the business, I need young people to make the pool neutral because I have the pool. If I only have sick people, I will lose the money. But I need young people because the young people will be maybe sick once every other month or whatever. Make balance because I know the elderly in the US, they represent 5% of the population. Imagine those 5%, they consume 50% of the healthcare budget. 5% consume 50% of the healthcare budget, while other 95 categories, they spend the other 50%. Imagine. So Obamacare, the insurance companies say, if you don't force people, young people, everyone to have health insurance, we will increase the premium. I will charge every family $5,000, for example. But if you force the health insurance, everyone buying health insurance, I will charge only $1,000. If you need lower premium, you need to increase the pool of the young people. Can you imagine this? It just makes sense. But look here, mostly young people, they are uninsured. While the elderly people insured 100%. Why? Because something called Medicare. Medicare is a governmental, it's a federal program to cover elderly people. Donald Trump, the President of the United States, tried to compare the US healthcare system with the UK healthcare system. And what he's saying here in his tweet, the Democrats, he means the US Democrats, like Obama side, are pushing for universal healthcare. What do we mean by universal? For everyone. It's similar to Iraqi or UK or Canada, everyone is insured or covered. While thousands of people are marching, thousands of people in UK are marching, protesting against UK healthcare system. It's going broke, the UK healthcare system is going broke and not working. And he's saying this system, the UK system, is not working. It's not good. Why I should adopt it? He tried to defend his point of view. Democrats want to greatly raise taxes for really bad and non-personal medical care. Because UK and Canada, they provide universal healthcare system like in Iraq. How can they get the money for this universal? The money will get it from the tax, the right. They will charge every employee for example, 40% of their salary at the end of the year. They would, like for example, if your salary is 1 million Iraqi dinars per month, you will receive only 600,000. You will say, why? You say 400,000, the government will take it because the governments need to support the healthcare system. They will charge a huge amount of tax because they need to pay the free healthcare system or services. This is so the Republican says, no, it's not working, no thanks. I don't want this healthcare system. So universal healthcare system is good, but it's costly for the taxpayer. If we need to make ranking for the healthcare system, we can notice here the UK is number 1, and US maybe number 9. If you ask me on what criteria you rely on, I would say quality of care, access, efficiency, and equity. What do you mean by access? Access means I can go and get the service. Why the US is 9th here? Because they have low access, not about the quality itself only. They have low access. They have uninsured people. That's why. While the UK, they have high access, as you can see here. So, healthcare provider and the government or health system, simply they don't have Ministry of Health there. They have Department of Health. They have public health department in every state. So those stakeholders and decision makers try to think, how can we improve the quality of the healthcare services? If I need to increase the quality, I need to have measures. I need to follow measures, some criteria, okay? I need to follow them so I increase the quality of service, not the quantity, the quality, okay? So they say one of the quality measure is the readmission rate. What do you mean by readmission rate? How many times you are readmitted after discharge. So if you are discharged from the hospital, if you are readmitted within 30 days of the discharge, the insurance company will not pay the money to the hospital. They say, you discharge this patient before he or she was stable. Because you discharged this quickly and you didn't do well, this patient readmitted within 30 days. I will not pay you the amount of readmission. You need to take care of that by yourself. Imagine. So the hospital now knows early discharge without stabilizing with low quality will cost them money because this patient will readmitted and will cost. So try to provide better service to prevent the readmission, okay? The second important, go ahead.
Who will pay the money? The patient or the hospital?
Not for the readmission, hospital, not the patients. Patients, neither the patient nor the pharmaceutical company, nor the health insurance company. Good question. Have you heard about medication reconciliation? Medication reconciliation. It's a term means, as a pharmacist or nurse, sometimes nurse, if this patient will be discharged from the hospital, I need to sit with the patients and I need to review the medications, the old ones and the new ones, and prepare a list, unified list for these patients and teach the patient or educate the patients about the final list. Because, for example, if this patient had bisoprolol before the admission has bisoprolol, in the admission the physician say you need to change it to atenolol, for example. If you don't do the reconciliations, the patient may end up taking both, which is both beta blocker, which is wrong. We cannot do this. So you need to say, the physician stop your old medication. You need to start this new one. This is the reconciliation. We need to fix the we need to try to manage the medication for them before they discharge. This will improve the adherence, reduce the adverse drug events. Other quality measures, HbA1c, I think all of you know the HbA1c better than me. So HbA1c is simply quality measures. If I need to control this diabetic patients, I need to keep the HbA1c, for example, less than 9 or less than 7, because it's a measure of follow-up for diabetes for 3 months or more. Simply, I need to look for the quality measures. Other quality measures, I need to give aspirin or antithrombolytic for ischemic heart disease. I need to give statin or lipid lowering for the patients with myocardial infarction. Have you heard about proportion of days covered? It's a measure of what? Proportion of days covered. We're talking about what? It's simply talking about adherence. Adherence. How can I measure the adherence? I measure the adherence, for example, if I have patients, for example, Abbas. Abbas is my patient in my pharmacy, and I have his record in my pharmacy. Abbas visit the pharmacy in the last 6 months, and he's my patient, like loyal customer. And during 6 months, he only took his anti-diabetic medications, clopidogrel or whatever. Only he took 5 months of clopidogrel, and we have 1 missing month. So I divide the number of days he took the medication, for example, 200 days, while he was at I have the history of 300 days, but he only took 200 days. So I need to divide 200 divided by 300. I need the percent more than 80%. If it's less than 80%, Abbas is not adhered to his medication. I need to keep the adherence rate or BDC high. I conducted a research with one of the postgraduate community pharmacy residents at the University of Iowa about the increase the BDC adherence of the patient with diabetes and hypertension, and it's pharmacist-led intervention to increase the adherence. And the pharmacist simply grab the phone and call the patient. They say, you need to take your medications. Please come and pick up your medications. And after discharge, they need to follow up with them. We published this study in American Journal of Pharmaceutical Education. American Journal, JAFA, Journal of American Pharmacists Association. It's 2018. So it's simple idea. Pharmacist's role to increase adherence by intervening through phone calls, which is one of the ideas. So the other, how can we increase the adherence? I said phone call, one of them. What the other one? How can we increase?
List. List.
List? What do you mean? How can we increase the adherence of the patient to the medication?
يعني مثلا نعطيك لستة حتى يلتزم بال.
Could be reminders. Could be the retail pharmacy, the community pharmacies try to adopt something called mail delivery. They say if you are diabetic patients, you are on this clopidogrel for forever, you need to take this. So I will do something called automatic refilling for you. Automatic refilling means I will remind you when you are done or before your medication is done. For example, if you have medication for 90 days, before the end of the 90 days, you will receive reminder or phone call from the pharmacy. Mr. Abbas, your medications need to refill, please come to the pharmacy and pick up your medications. Something like that. And they have other services, they call it mail delivery. What do you mean by mail delivery? If you authorize me to deliver your medication to your home, just put your credit card, give me authorizations, I will deliver your medications to your home, delivery mostly free. It's one way to increase the adherence. Because if you increase the adherence of your customer, you will increase the quality or star rating of your pharmacy. Because nowadays, US pharmacies, they have ranking, stars, مثل الهوتels اللي عندنا. 3 stars, 5 stars, 5 stars mean perfect line. But they need to increase their stars by increase their customer BDC. So you need to adapt automatic refilling, you need to adapt the mail delivery, they try to call them. This is the star rating I'm talking about. This is the star rating for this because it depends on the BDC of cholesterol, BDC of diabetes, drug-drug interactions. So this green lights mean they have high stars, red color mean they have low stars. We are done with the US healthcare system. Now we move to countries in North America, neighbor to the US, northern US, Canada. Canada is a smaller country than the US. They have 10% of population compared to the US. US has more than 300 million people, while Canada have almost 30 million or something more. So it's like 10% of the populations. They have huge amount of surface area, but they are really have 10 provinces here in the border of the US, and the other territories, those northern territories, those usually like freezing areas, and you can find rare people living there. It's really cold area here because it's in the north. What's going on in Canada? Canada, they say every single person has the right to have health insurance. So they have the universal healthcare systems. If you are Canadian, you will have health insurance. But I will deduct tax from your salary to pay this health insurance or health coverage. They don't have health insurance, single health insurance. They have 10 provinces or 12 provinces with 3 territories. They have 15 different healthcare systems with S. So they have 15 different ones, but all of them, they are the simple way in Canada. They say you have the right to visit the private clinic you want or private hospital, but the private hospital will send the claim to the government. The government will pay the money. So it's simply, they don't force you to visit the governmental, because I'm not sure if they have governmental public sector or not. I'm not sure, but I think they don't. They rely on the private providers. It's not like here in Iraq. In Iraq, we have exactly as UK. In UK, government pay the salary to the physician and other healthcare providers. And those providers, pharmacists, physicians, they are employee to the government. The government is the employer. While in Canada, no. In Canada, the private healthcare sector, they send the claim to the government. The government will pay the money. So the government pays your insurance bill. What do you think the disadvantage of such system? Everyone is insured, and they don't have co-insurance or co-payment like the US. The US, those are private sector. They know how to reduce the frequency. They have co-payment and co-insurance. If you visit, you need to pay something. You need to put your hand in your pocket and grab money, and you can feel the pain here. So you don't visit the physician if you are not in need. While in Canada, they don't have this. You can visit the healthcare system anytime you need, free of charge, totally. What do you think the disadvantage of this?
To reduce the quality because of long queue and more.
This one, it will be long queue, long line. You need to wait for long times to get the service because everyone pretend sorry. Everyone, I say, if you go to the physician, you like long line to the physician. Why? It's free, you will pay nothing. This is a disadvantage. If you are really in need, but you have to wait. The criteria of the Canadian healthcare system, all this information new for you guys, kind of. This is the idea of introduce. This topic was not in the syllabus, but I talked with Dr. there. I say, let's teach them something new, because I know eventually we are going to teach you something about the disease. You can find this in applied therapeutic. But this information It's kind of summary of my expertise in the U.S. healthcare system, or because this information it's hard to be, because I took like several courses about U.S. healthcare system and other healthcare system in the University of Iowa during my PhD study there. So it's kind of hard to be found such information. That's why we introduce such information for you guys. Good. So it's public administration. The government will run the claim. Comprehensiveness, they pay for every single service except eye and dental, I think. Portability, what do you mean by portability? If you are insured in Alberta and you travel to Ontario, you are also insured. It's not say like you have Medicaid in Alabama, but if you travel to Iowa, like in the state, Alabama, they have different eligibility for Medicaid. And you may lose your Medicaid if you travel to Iowa because they have different criteria. It's state criteria. But here they say if you are insured in Alberta, you are insured in British Columbia. Can you imagine those? Because you are insured in every province. Universally, every single person. Accessibility, you can go whatever you want to go, every single one. Every provider you choose. But in the US, they have something, I forgot this point. It's so much detail, I don't want to, but now it's the time to say it. In the US, they have something, they say it preferred provider, or they call it network. For example, my network was University of Iowa, because I'm the employee of the University of Iowa. I need to go to the University of Iowa hospital, but this is my network. If I go to the University of Iowa hospital, I only pay $10 as co-payment. But if I need to visit private hospital, Mercy Hospital, I need to pay, for example, $50. So they discourage you to go outside the network. You can go, but they discourage you by higher co-payment and co-insurance. They limit your choices, which is the good way because they have good negotiation with the Iowa, while they don't have good negotiation with the Mercy. Mercy, you know, will charge too much, and the university they don't want to pay this too much money. You need to know those terms well, okay? Canadian healthcare systems, I think I already mentioned those. The people, they are not worried like Iraqi people. Everyone sick can go to the hospital. You don't have to worry. But in the US, if you are uninsured, you are in big trouble. Canadian healthcare system, the single payer, the government is the only payer. While in the US, the employer is the payer, the government is the payer, the state is the payer. You have multiple payers. But in Canada, only the government, the single, which is good in this case because they have strong negotiation power. They will reduce the price, but at the same time, they put guidelines. They say, if you are above 65, you are not eligible for knee surgery or for example, they put their own rules. They put barriers because they have to control the market. No one can compete with the government because they are the single payer. And in this case, you need to wait a long time to get the next slide. You need to look to the waiting list here in Canada. It's almost 3 or 4 times of everything: gynecology, cardiology, or orthopedic. Can you see the waiting time? In the US, for example, here in Canada, 1 of 5 Canadians say, I need to wait more than a week to visit family physician. If you need to visit GP, you need to wait a week or more. Imagine. If you need to visit a specialist, cardiologist, you need to wait more than 4 weeks. Imagine. And 1 of 3 Canadians say if you go to the emergency room, you need to wait more than 4 hours. So this is the waiting time, it's really long. And this, sometimes Americans make fun of the Canadian. They say, why you cross the border to make surgery in the US? If you have good healthcare system, why you are crossing the border to make surgery, for example? Because the waiting time is long, or you are not eligible. So this is the big problem here. So every system has pros and cons. Cons, the advantages, and pros, those advantages. Okay? The second system here is the the second system here, third system, the government is the employer, the healthcare providers are the employee. In Iraq, we have private sector. I think in the UK they have small, growing private sector, but in Iraq we have, I think private sector in Iraq really now has good contribution. So simply our public healthcare system is similar to the UK healthcare system. They call it National Health Services, NHS, which is old as 1948. The government will pay to the hospital doctors, no family premium, no co-payment, and the spending is low because the government control everything. So it's only 8%, while in the US it's 16%, the GDP. It's a protesting people, maybe they don't like it, you don't have choices, if you are sick, you need to go to your family doctor. The family doctor, we call it gatekeeper. Gatekeeper means the family physician hold the door. You cannot pass through the door unless you pass it through the family doctor. You need to be seen by family doctor before you be referred to the specialist. And this will take time because you need time to make appointment with the family doctor, time for the referral, time to see the specialist, and this may take even a couple months. This process, imagine if you need to see specialists. That's the advantages of this universal healthcare system. But if you need to make in numbers, it seems the UK, they are doing well as ranking here, ranking quality, access, efficiency, equity. So really they are doing well. It's low number mean good quality, 11 mean the worst one. So 1 means the best, 11 means the worst. Can you imagine? The US, they have couples here, 11s, while the UK, they are doing well. Can US spend the most, the higher spending, as you can see in this line? Taiwan is a small peninsula south of China, historically part of China. Now it's almost independent country. And what they did, at that time, they needed to create healthcare system. They gathered a group of stakeholders, healthcare provider, expert in the field. They sent them around the world. احنا بين قوسين جماعتنا نروح من افادات، ما اعرف ايش قد نستفاد من افاداتهم، بس هذول دزوهم افاد قالوا لهم تروحوا نشوفوا شكو ماكو بالعالم وتشوفون الاخبار. They took this team around the world to see the Canadian, the US healthcare system, European healthcare system, and they come back to Taiwan and they created their healthcare system. Their healthcare system kind of unique. It's Taiwanese need to pay also premium, so it's not free. And you still need to pay co-insurance and co-payment. And the insurance company, it's one insurance company run by the government. So you need to pay the government or the insurance money, this amount of money for the family, which is not bad. 650 for family is not bad as compared to the US. It's more than 1,000 in the US, imagine. And government will take care of you, okay? The good things in this system, I like the ID here. In the US, I was patient in the US. When I visit the university hospital, I was the permanent, for example, patients for the university hospital. But when I needed to visit other hospital or other provider, I need to tell my story again. I need to tell my history, patient history, social history, medical history again and again for every visit to the new place or new provider. Which is kind of it's kind of, sometimes I say, when I visit the dental college, they say, what do you have diseases? They say, do you have the same system as they say, no, we need to tell all the story again. But in Taiwan, by taking this ID, you take this ID with you to any provider, they put it in the machine, and all your information will be on the computer. So your history and your ID Imagine if you go to new provider, your history is easy to be obtained. They don't have to ask you all the questions again. So it's good because if somebody unconscious in the street and you find the ID put in the machine, you will find this patient is diabetic. But in Iraq or other countries, they don't. If somebody unconscious, you don't have an idea which kind of disease this person has. This is the problem. So I like this part. Switzerland is one of the good healthcare system in Europe. They spend, all the countries spend less money than the US. So they still need to pay premium. They still need to pay co-insurance, co-payment, and they have non-profit insurance company. They have, I need you to focus on the differences between healthcare systems. In Taiwan, we have governmental one insurance company. In Switzerland, they have multiple non-profit organizations, okay? I need to find out the differences. Switzerland, Japan is one of the best healthcare system. But the family will pay less than Taiwan. Imagine 280 only premium, which is cheap. 30% of the cost of procedure. The government negotiates the price with the provider. The government tried to push the price down, try to negotiate with the provider. Still, they have less amount of spending than the US, as you can see. Iraqi healthcare system, you know Iraqi healthcare system, but historically, the British created or built the Iraqi healthcare system in 1921 when the Director of Public Health Services converted to the Ministry of Health. So Iraqi Ministry of Health developed in 1921. And during the 80s and 90s, there were laws say health insurance or health coverage is a right for every citizen. That's why we have this universal healthcare system. In 70s and 80s, Iraq had the best healthcare system in the region. تحتاج حسين؟
لا مو الباتري راح يخلص.
Iraqi healthcare system, you know those, but just for your information, it's the governmental is free, private sector out of pocket. We don't have health insurance. I wrote this in my article in Pharmacy in Iraq in 2013, published in American Journal of Hospital Pharmacy. I was expecting Iraq will adopt health insurance in a couple of years, but my expectation was not accurate because Iraqi, they don't want to pay something because they think they have the right for free healthcare because we have the oil, the government should pay us.
But now the government is taking, not like.
Yes, no, there is a co-payment.
There is a co-payment. Yeah. Always there's. I'm talking about health insurance because the Iraqis they say, you know, all those universal healthcare system for more than 100 years. So the people they are not maybe willing to pay money to health because if you want to pay health insurance company, I think Al Kafil Hospital or something in Najaf they have kind of provider health insurance.
Provider from
for a group. For the company, you need to pay the company or the hospital, and you need to take the service within this hospital or company. It kind of health insurance.
There's an organization that will pay some of the bill, but you have to pay the other.
Oh, okay.
Very expensive.
Yeah, and
Very
it's also
Okay.
private, so it will be expensive.
It's also. I'm not sure if it's.
But it's about service because the governmental is worse service, so you have to.
Yeah, it's waiting list as well in the governmental sector. It's paper-based. While in the US, most of the hospital they adapted electronic, as you know, electronic health records and even electronic prescription. Finally, we have fragmented healthcare system. What do you mean by fragmented? Because if you go to the clinic, they don't know your history in the public hospital, so it's fragmented. There is no connection. You don't have an ID. Nobody knows your history. If you go to the new physician, they would say take out all those old medication, put them in trash, and start over. We don't have this background information, which is one of the weakness or limitation of the Iraqi healthcare system. So this is the new WHO ranking. Iraq 103 among 190 something. As you can see, Japan number 10, US 37, India 112, China 144, Bangladesh is better than us, it's 88, it seems. So we need to improve our healthcare system. This is the indicator by the WHO. Germany, you still need to pay premium, still co-payment. They call this sickness fund. Sickness fund is the term for the health insurance company, main health insurance company. And the sickness funds, the company negotiate. The insurance companies, the big insurance company, they try to negotiate with their provider. They even negotiate in the US. I was familiar with this. They negotiate with the pharmacies to reduce, because the pharmacies, they have something called dispensing fees. The prescriptions cost is like two components, the medication fees and the dispensing fees. The dispensing fees is the contract between the pharmacy and the health insurance. They will say, you need to sign the contract with me. You cannot charge more than $10 per prescription. And this is the contract between the pharmacy and the health insurance company. Otherwise, if you don't like the contract, I will not send my patient to you. For example, CVS. I remember Walgreens, one of the chain of pharmacy chain in the US, they lost the war against the health insurance company. The insurance company say, either you take the deal or not. They say, no, we'll not take it, because we are big chains, we have hundreds of pharmacies across the state, we will affect your patients. And they say simply, my patient don't go to Walgreens, go to CVS or Walmart or whatever. After 1 or 2 years, Walgreens start to lose the money because they lost the customer. They say, okay, we agree, we take the deal, we take the contract, we will sign it. They lost the war. So insurance company, they have the big power, especially if they control the state. So Germany, they have big insurance company, they call sickness fund, which is, I think, governmental bargain with doctors. 10% of population has private insurance. So the sickness fund, or similar to other healthcare system in the Canada, like tax subsidies paid to the insurance company or central health funds. The sickness fund will pay to the physician, hospital, and drug. So the government take the tax from you, give it to the big insurance company. Insurance company will pay to the provider. I think we are done with this lecture. The final questions, what do you think? Which one is the best health insurance system, healthcare system here? It's fragmented, it's expensive. There is no ideal health insurance or healthcare system. Everyone has pros and cons, but still in the ranking you can find German, Taiwanese, Japanese maybe the highest, Iraq, US maybe the down, and I'm willing to receive any question.